Welcome to Conversations Different, a podcast from the Santa Fe New Mexican about the interesting people, issues, and places of northern New Mexico. This is Inez Russell Gomez, your host, and today I am speaking to Ted Alcorn, a reporter with special expertise on public health issues and particularly the alcohol abuse crisis that is occurring in northern New Mexico. Ted, thanks for being with us.
Thanks so much for having me.
So let's go back a couple of years to a series that you wrote for New Mexico in Depth, which we published in the Santa Fe New Mexican. I think it was 2022. It's called Blind Drunk. Talk about what led to that, and then we'll get into what you found.
Well, not to give you too much of the details, but my editor had assigned me a story to look into the relationship between alcohol and COVID, and I was just looking around at the data related to alcohol-related harms in New Mexico, and I came upon a statistic which said that alcohol-related deaths in New Mexico were higher than in any other state, and not just like we were first and second and third from time to time. We have way more people dying of alcohol related causes than anywhere else in the country. And as somebody who grew up in Albuquerque in the 1990s, I was aware of the state having a big problem with DWI back then. So I knew that alcohol had a role in some of the harms in the state, but I hadn't really appreciated how significant it was. And so I started to report and learn a little bit more about the history of the state and its relationship with alcohol. And the more I learned, the more I thought, this is an emergency in plain sight. Alcohol kills more than 2,000 New Mexicans each year. Um, in the first year of the COVID pandemic, alcohol actually killed more working age adults than COVID did in the state. Um,
People were at home, and a lot of people were depressed, and they drank a lot more.
Yeah, and it's been a problem for a long time, but it's been getting a lot worse. And particularly in the last few years, we've seen double-digit increases in alcohol-related deaths, and it's not necessarily due to the factors that I came to thinking about. DWI, like I said, was really at the front and center of my vision of alcohol because of all the amazing public relations and policing interventions that were done in the 1990s, which in fact drove DWI down a lot, death rates down a lot in the state.
It actually worked.
There was a whole of government approach that began in the mid 1990s, and we threw the kitchen sink. We did everything we could in terms of enforcement and education, and it did work. But fast forward to today, DWIs actually make up about 1/10 of all alcohol related deaths in the state. By far, the majority of alcohol related deaths are people that have drunk a lot throughout their life and develop chronic liver disease or liver cancer, or so they have some sort of chronic illness, and that puts them in the intensive care unit of the hospital. And talking to the ICU doctors nowadays, about 20% of the beds at UNM are occupied by someone who's there because of their drinking. So, there's a lot of people dying of this, and I wondered why we didn't seem to hear more about it and why there wasn't a more of a whole of government response now to this crisis. And that's really what led to me to report that whole series.
Right. And when we were talking before the podcast went on air, you talked about it as a slow boil. And it seems like when there's a really horrific alcohol crash, as when Gordon House in the 90s hit the family on the highway and killed the Cravens and the little girls, uh, everyone responded and passed laws. But when it's, some old man dying of liver cancer quietly with his family around him, and that person is multiplied by a dozen, we don't respond to it as though we are in a crisis, which we actually are.
Yeah, I think that's a really good observation. And certainly the state, when we have taken action on this issue, it's been motivated by something that was spectacular and bad. And car accidents, are in the public eye, and they certainly, when the victims have been so tragically uninvolved with the alcohol in that case, it brings sort of a special pressure on lawmakers to act. I do think also, though, the solutions now are a little bit more difficult to address because alcohol, the problems that we now have to deal with related to alcohol have to do with our levels of consumption, and most of the solutions to reducing our alcohol related harms have to involve reducing irresponsible or excessive amounts of drinking.
Right. And now there's a lot of new public health research that says almost any amount of alcohol is probably not safe, which is a little depressing because a nice beer with a sandwich or a glass of wine with dinner is something that we've all, people who imbibe have enjoyed. But they're getting to the point that they're saying that even isn't safe. But when you go too far and become puritanical, as we learned with prohibition, then you get into a point where nobody listens. So, one of the things that I found so fascinating about your series is that it looked at ways to reduce excess drinking through raising alcohol taxes, but also more prevention strategies. And in New Mexico, we're not really doing either very well, it seems to me.
Yeah, I think that largely this has been an issue that's just sort of escaped the radar of most people. It's sad to say, even in the Department of Health, prior to our series, the Department of Health hadn't issued but a handful of press releases related to alcohol in the last 10 years. They released dozens of press releases related to Zika, um, you know, uh, vaccination,
Hantavirus.
so forth. Yeah,
Yep.
but this wasn't something that they'd put on their radar.
Yeah, it seems that one of the things that has to happen is there has to be at the highest levels an attempt to say we're going to reduce. I mean, that's a public health strategy is reduce harm. So maybe you don't stop drinking completely, maybe you don't, ban alcohol from public spaces, those would be extreme, but you say how can we reduce by 5%, 10% the number of people who are suffering and dying because of alcohol? And then you take the strategies that you reported on that work. I mean, what works to reduce deaths and harm?
Well, the CDC has actually looked at this to a fair degree, and some of the strategies that are related to alcohol, reducing alcohol's harms, are sort of classic public health strategies. We can get doctors to screen and ask people more often about, their drinking, and try and make sure that people who are drinking too much are pushed towards, or know about treatment options. We can reduce the density of alcohol outlets. Some cities have tried to reduce the number of bars and liquor outlets that are selling alcohol. But the kind of favored strategy, the one that seems to be the most effective and that costs the least, is very simple. It's just to raise the price of alcohol. And the way that places have done that is usually by imposing a tax on alcohol, a tax that then the producers or distributors pass on to the customers. And it's kind of classic economics where if you raise the prices of a commodity, people consume a little bit less of it. And when we're talking about alcohol in the state, it's really, most of the strategies aren't about getting people to stop drinking. It's just about trying to get people to drink a little bit more moderately, and reducing your consumption even by a couple of drinks a day. If you're a heavy drinker, can have demonstrably better outcomes for your health.
Oh, I like that. On that note, we'll take a quick break and be back in a moment with more conversations different.
We make renewable doable. We're positive energy solar for a cleaner, brighter future for all. Positive energy's the right call. Feel good about your energy bill. Help save the planet too. Your trusted solar company, working hard for you. Generate positive energy. Positive energy solar.
We are back with Conversations Different, talking to Ted Alcorn about New Mexico's uneasy affair with alcohol and alcohol consumption and the harms that it causes. Uh, you talked before the end of the last break about raising alcohol taxes, and that is something that we find it very hard to do in New Mexico. It's been how many, 3 decades plus since we raised them?
More than 3 decades. Yeah.
Yes. So just keeping up with inflation in terms of the percentage of taxes compared to what it costs to buy a drink has not happened.
No, I mean, to the reverse actually has happened. So as the years have gone by, our alcohol taxes, which are about 4 cents to 7 cents per drink, it's stayed that way. So as the price of alcohol has climbed, the tax has become a smaller and smaller share of it. Alcohol taxes today are less than half of what they were in the 1990s when you adjust for inflation. So the state taxes on alcohol are having a very negligible impact right now.
Right. Now, we won't go into all the maneuverings of the legislature over the past several years, but when your series was published in our newspaper and on New Mexico On Depth's website and other places across the state, it really, I think, caused people to sit up. It was the best kind of journalism. It shed a light on a problem and said, here's how you can fix it. But it seems like many legislators do not want to hear the truth. Or listen to the facts, perhaps because alcohol is a huge contributor of money to their campaigns. And there's mom and pop brewers that really are struggling to stay in business and they were worried about their survival. But whatever the reasons, we couldn't even get like a half of a penny of 1% passed.
I'm not going to lie. I think that this is a pretty tough issue to solve as a society. And I had this great privilege, I think, to talk with over hundreds, probably over 200 people in the state, past and present alcohol experts, law enforcement, bartenders, brewers, people with serious alcohol dependencies. I talked to the whole spectrum of people. And I got the sense very clearly, that there was a problem. And I could also talk to the scientists. And like I said, there's quite a lot of a track record, both within the United States, but also internationally, of policies that work to reduce drinking. But to do this politically, I don't think that there's a blueprint or a roadmap. And there's a lot of challenges to making these changes as a society. There's a big vested interest. There are probably about $1 billion worth of alcohol sold in this state. And it's not just earnings that go to a few companies, although the big international companies like Anheuser-Busch are certainly the ones that sell the most. Restaurants depend on alcohol sales. They're one of the most profitable things they sell. Ski areas, movie theaters now, a lot of different kind of business interests benefit from alcohol. And if you tell them that you're trying to reduce people's drinking, they think about their bottom line. Politicians respond they listen to small businesses in their area, and they're concerned when they hear kind of this hyperbolic rhetoric that, oh, you're going to put the hospitality industry out of business, particularly coming after COVID. And then I think that the people that were organizing to do something about this, there's not a lot of big organizations that are working to try and help people who have alcohol related harms. There's a small group of advocates who are doctors who really saw this firsthand among their patients. A strong constituency out of Gallup, New Mexico, which has struggled and really done some innovative things for the last 20 years to try and address alcohol there. And there was certainly a lot of other nonprofits that got involved, but they didn't have the power that the alcohol industry does. And the alcohol industry spends big in the legislature. We track the dollars that they spend, and they know who to spend it on. They make their biggest contributions to the tax committee and to leadership, because those are the people that control the flow of this kind of legislation.
Yeah, and ironically, the legislature operates after hours through parties at which a lot of alcohol is served. And they even drink at the Roundhouse, which was something I really didn't realize until a couple of stories came out a few years ago about, after hours of drinking. And I was just like, wow, I don't get to go to work and get drunk. So
Yeah.
it seems like it's part of just so much part of the culture in doing business that it's very hard to fight.
It's a representative body for a reason. And I think that, the challenges that we as a state face, absolutely individuals in the Roundhouse face too. And I know there have been legislators who have had alcohol dependency and who have not been able to stay in that environment because it's not healthy for them to be there. And we've seen scandals come and go related to alcohol. So they're just like us in that regard. But yeah, it's a tough challenge. It's hard to go after it. Now, nonetheless, in the last 3 years, things really did look like they could be different here. I think the problem was really getting a lot more serious. In terms of the deaths, we could see the state was just like climbing linearly, at least, if not exponentially. I think the series that we worked on and that you all helped really get in front of a lot of readers did motivate a lot of conversations about this. And then longtime advocates and legislators who had taken an interest in this, use that moment, I think, to try and bring some legislation that they hope would make a difference. And so for the last 3 sessions now, legislators have introduced what they would probably say are pretty ambitious proposals to curb alcohol related harms in the state. Um, and they've been debated for a long time in committees. They've been passed by committees. They just haven't gotten over the line. And that's sometimes is a multi-year affair in New Mexico.
No, I was just gonna say, like with payday lending, how many years did it take to finally get rid of usury in the state? So I think the fact that they keep getting a little farther, and even to the point, I think one of them, one increase got vetoed by the governor in a line item. So we're talking about progress, and it seems to me if we can get some sort of increase, which is then tied to inflation, so that you don't have to debate this all the time, you might get to a point where it could make a difference. Is it in your reporting, would it be better to have the money from an alcohol tax instead of going to the general fund be targeted for rehab and building rehabilitation and funding them? Is that a good way to use the money so people feel they're getting something?
I think certainly people who are in the provider community in New Mexico say there's not enough resources. Um, and there's been a lot of rebuilding over the last 10 years since the Martinez administration famously dismantled kind of the behavioral health system of the state. Now, I think that we've caught up a lot. But certainly people in that community would welcome more resources and more attention to this issue. I think that it's not just about dollars, though. It's also about leadership. And, we have a Department of Health, but they've really not been empowered to address this issue seriously. And it's not very clear if it's even a priority or a thing that they think are working on right now. Like you said, the governor vetoed even the modest tax increase that was passed 3 years ago. This year, the legislature again kind of whittled down the ambitious proposal until it was a penny a drink increase, and the governor actually vetoed the entire tax package, which included that again. Um, so there's not been much pressure at all from above to do anything about this, and so I think that most of the research would suggest that the tax increase, its biggest benefit is really on reducing marginally the amount that's consumed in the state. But putting those resources back into communities that need it most, and this last year, the there was both an interest in putting into the general fund, but also directing funds specifically to alcohol harms alleviation fund for tribes and pueblos, and people in the state who have suffered historically a much higher rate of alcohol related harms. That's something that I think many would say would be very beneficial.
Right. Going back to Gallup, I mean, it's the only county, if I'm remembering correctly, that has a local option liquor tax, because that's another solution that people can have, is we could choose in Santa Fe or Rio Arriba or San Miguel or wherever to tax liquor so that we can put money in locally. And
Yeah,
Gallup does that.
yeah. Gallup has its own small county tax on alcohol, and they've been, like I said, a little bit out ahead of the state in terms of this issue because that community has been so affected by alcohol. Um, so so yeah, that's definitely something that other counties could look into.
Yeah, because we'll get to this at the other end, but we'll take a quick break and be back in a moment with more Conversations Different. We're back with Conversations Different and Ted Alcorn talking about New Mexico's alcohol addiction. One of the things that I think is missing too often from this discussion, which your series and later reporting really put into context, is how alcohol affects every other one of our problems. I mean, it's the awful joke that we keep saying in New Mexico, we're, first on all the worst lists, last on all the good lists. If people weren't as addicted to alcohol, which then I think combines with drug abuse and other substance abuses, would we be, as poor? Would we be as violent? Would we have as many pedestrian deaths? All of the things that happen here that make our quality of life not what we want. I mean, how do we get people to understand the connection so that they can actually take action?
Yeah, and I think that a lot of people do understand the connection intimately because they've seen it to a degree. We see it in our own families, right? You see alcohol related harms, or in our friends, or something that we sometimes have struggled with, um, where you see people make bad decisions related to alcohol, or where their health is deteriorating because of it. So people kind of intuit that there's this connection, but as part of thinking about public policy, we often don't sort of connect the dots. When the mayor of Albuquerque or the governor talk about violence and crime in the state and what a big deal it is, they never bring up the fact that 30% of homicide involve alcohol. Based on the toxicology that we have, at least of victims. Um, we don't talk about how the fact that about 40% of the suicide deaths in the state also involve someone who was drinking at the time. Um, so much of the trauma, where we have a state that has really high rates of adverse childhood experiences, um, a lot of that can be linked back to alcohol and abuse. And it flows both ways. It's not a one-way street that alcohol causes these harms. Alcohol is also something that people seek out to treat, to self-medicate for some of these problems, but it's something that we can really work on in terms of public policy. And I think that being able to recognize that it's connected to some of these other problems that are top of mind for legislators: crime, public disorder, healthcare
Homelessness.
spending, homelessness. Um, but it's unmentioned, and people don't think of it as a vehicle to address those things. And I think that it is a missed opportunity for policymakers.
Yeah. I mean, when you think about the diabetes epidemic or the obesity epidemic, even apart from your liver failing when you're 40 because you've been a stone cold drunk, for 20 years, uh, all of the spending on those big conditions that we face as a state and individuals might be reduced if people just drank less.
Yeah,
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 because I mean, the trouble when you drink, in terms of calories, it makes you hungry at the same time. So you're getting alcohol calories plus you're eating a pizza late at night because you call Domino's, and it
yeah.
really puts on the pounds.
Well, and it's interesting. I mean, the youngest generation now, who are more attuned to health and wellness, are drinking a lot less than their predecessors, and the alcohol industry is freaking out, to be honest,
Right.
because they don't know what's happening to their future customers. But people who are concerned about their sleep, like you said, about their nutrition, have started to recognize that alcohol can really disrupt those things. And so it's part of a big cultural change that's happening. It's interesting. It augurs a different future for those young people.
Right. And again, you want your small businesses to succeed, and there's, a lot of fun in going to a brewery and having a locally made beer that tastes kind of like New Mexico, and you enjoy it. But that's different from, living in a world where people get up hungover and go to work and have to deal with, being a functioning alcoholic or then losing it and then not being able to work.
Well, I think that the measures that were introduced, which we're talking about at their most ambitious, were 25 cents per drink increase, and this year a broader group of legislators settled on an approach that was, looking at between 3 and 6% increase. Um, we're talking about a pretty modest increase in prices, and these are thought of as very ambitious. Would you notice a 25-cent tax on a $8 beer or a $10 margarita? I'm not sure that I would. Um, and and to be honest, the impacts are also going to be modest. At least the public health people that model these things suggest, you're going to see a small reduction in drinking in the single digit percentages. You're going to see a reduction in deaths. It's not a silver bullet solution by any means. Like a lot of things that are in public health, it's almost invisible. But public health has been very successful at improving human life, extending human life and improving human well-being by making those incremental changes time over time. Um, the problem here in New Mexico is each year inflation takes a bite out of our alcohol taxes, and it actually makes it cheaper to drink. So we're
Right.
actually moving in the wrong direction.
Yeah, no, that totally makes sense. And there's so many more choices. So I think the competition probably helps keep the prices, at least, for beer and craft cocktails and things that are maybe locally made, they're not as extensive, they're not as exorbitant as some things. Um, Going back to the idea of prevention, it seems like alcohol is so attractive in the ads and in the, you see it at the ball field, you see it at concerts, it's everywhere. Is there a way to maybe make it less everywhere, so that we can have fun without having alcohol?
Well, the challenge is that the forces are really stacked against you. The alcohol industry as a whole, at least globally, spends billions of dollars on advertising and on promoting, culture of drinking and associating with positivity and fellow feeling. And the resources that they can summon will never be matched by government or by any public entity. Um, there have been states that have tried to put out their own little public health campaigns. Oregon was one who did something called Rethink the Drink, where the health department spent, a six-figure sum on advertising. Um, but this is sort of, you're not likely to get many eyeballs on this compared to television ads that people are seeing on Super Bowl Sunday and so forth. Um, so some of the other things, nonetheless, that a government can do involve, education through all the public health channels that they have, making sure that clinicians are talking about this and are talking with their patients about it. So there's ways of adjusting and tailoring culture. And to their credit, I think the Lujan Grisham administration has tried to increase or motivate doctors to do more of these brief screening and intervention for treatment for alcohol. But that's kind of the only area that I've seen them really make any announcement that's on this related to.
Yeah. Interestingly, for me anyway, I went to a music festival in North Carolina with my best friend from college, and it was a no alcohol festival because the person it was named after basically had a problem with alcohol. So his family didn't want any alcohol. And I cannot tell you the difference in the atmosphere versus a concert I had gone to in Taos the year before where everyone was drunk. And I can say if more people go to non-alcohol related events and have a great time and no one throws up on them, they might understand that it's not always necessary. It was a real learning experience because I didn't know what it would be like, and it was great.
Yeah, I went on a family vacation to a little resort in Mexico at some point during my reporting, and it was after I'd spent a lot of time talking with people about alcohol, talking with people in recovery about it. I was went to some meetings with people who were, staying sober together, and then going on this little vacation. I was shocked by like how ubiquitous alcohol is in like a lot of the rituals of being together. um th- you know and it was strange to me to realize like this business model entirely really would not work without it. And so it made me feel a little bit apart when I was doing this reporting, but once you start to pay attention to it, at least in some circles, it can be pretty striking.
Yeah. It's a different way of living, and it's not that it's wrong to have a drink or to enjoy a drink. It's just important to understand the effect that it can have, not just on your life, but on the community. And I think that's the intersection of alcohol, over intoxication, and our public life, I think is so important. And I agree with your reporting that if we can kind of ratchet back just a little bit, we're going to have more people live, more kids have their dads, just a better public life for all of us.
Yeah, by the numbers, the CDC and others have sort of added up the costs that alcohol imposes on the state. And right, we have a big public health insurance population that's very dependent on public health insurance. A lot of the criminal justice system, in terms of policing, prosecution, and prisons, is related to alcohol-related problems. When you add all those things up, the state is spending a couple $1 billion a year on the harms of alcohol. That's your taxpayer dollars that are going to support those services. And the question is like, couldn't we use those resources better in a better way? There's a big opportunity cost to sort of living the way that we are. It just happens to be invisible, and the drinkers aren't really picking up the tab for that. Taxpayers are. So I think that does definitely beg the question of if we could live better. Now, people should make their own personal choices by all means, but I agree with you that when our choices impose things on other people, they really should be subject to conversation together about how to do better.
Yeah. And we're going to be, perhaps, I don't know if the governor is still going to follow through and hold her special session on public safety, but it seems to me that I hope some of the voices are going to be saying, when they talk about public safety, to talk about the role alcohol plays in undermining it.
Yeah, it would be interesting to see, and there's definitely evidence to suggest that where alcohol taxes have been imposed and increased, that there's fewer alcohol related crashes, and it would be amazing to see that as part of a bigger package related to reducing violence and violent injury in the state too, because we
Yeah.
have very high rates, obviously, of homicide and of suicide, and both of those are heavily alcohol involved.
That's right. And if you're going to have a person exercising their First Amendment rights or Second Amendment rights, we would hope that they wouldn't do it while they were drunk. But as we know, they do. And so it's that collision of alcohol and bullets that is really unsafe. And then you've just got alcohol and fists because it's such a factor in domestic violence. So, for a number of reasons, the reduction, using the public health harm reduction model could make a huge difference in how we live.
Yeah, so it'll be interesting to see, the legislators who have been the most persistent advocates for making some sort of change say that this will be a topic against in the interim session. My personal sense from speaking with some of the advocates is they're pretty tired out. They've been worn down from a lot of years of having trouble, um, making progress on this. So it'll be interesting to see. They have broadened their coalition, and last year a more diverse set of Democratic legislators were sponsoring and supporting this initiative than ever before. But they still couldn't get it through to a full vote.
Right. Well, that everything takes longer in New Mexico, but hopefully at the end, when we do get something passed, it will be, solid legislation that makes a difference. And on that note, it's been a great conversation, and thanks for being here, Ted.
Thanks for your interest in this. Great speaking with you.
All right. This has been another conversation different. We'll be back next week.